Hi, Jeremy here, Modern Vitality. In today's video, we're talking about complex chronic health conditions, right? Fibromyalgia, Lyme disease, mold exposure, long haulers, chronic fatigue syndrome. There's a ton of these, and they're on the rise in Western society. In case you haven't noticed, this is becoming more and more common and prevalent. Autoimmune conditions, they're on the rise, right? There's a lot of reasons for this, which you can see in my other videos where I go into some of the triggers and causes of these things. But today, in today's video, we're talking about a very specific point in the healing arc for a lot of people. There's so many people that I work with these conditions, and this is such a common sentiment that I feel like I need to address this because there are so many problems associated with this misconception. But it's something maybe you've heard before where people say, but you don't look sick, right? Oh, you say you don't feel good, but you don't look sick. Or you look so healthy, you look good, right? We're going to tear this apart in this video. I'm going to analyze some of this, why people think this way, and also some of the implications when you're actually trying to get help and how much better things would be if your doctor didn't fall into this fallacy, if your family members didn't fall into this fallacy, right? And also how to move forward, because that's probably the most important thing. Wouldn't you like to, I know it's a lot of effort, right? To actually try to not look sick, right? Wouldn't you like to feel as good as you can make yourself look? Wouldn't that be cool? And we have strategies to do that. So today is a very important one. It's a little bit controversial, but let's get started. You don't look sick. This is the early phase usually for most people when they're going through a complex chronic health condition. There's this kind of phase where it's the all in your head phase where people aren't really sure if they believe you. And a lot of times with some of these conditions like fibromyalgia and now like long haulers is one of these where there's some argument about whether it's real or not. Chronic fatigue has this credibility problem. There are a lot of conditions that have this kind of credibility problem. And I've talked about that in other videos, which basically means it doesn't mean you're making it up. But the credibility problem is usually the failure of the system to understand the problem in a sufficient way so that everybody kind of knows that it's real, right? So most people I meet, they've gone through a process where you have all these symptoms, brain fog, fatigue, feeling exhausted and all that. Sometimes weird moving pains, like things just are inflamed in strange ways, or you're swelling or carrying fluids that you can't really move, right? That's another one. Nerve issues where you're getting like vibrations in your nervous system, or there's lightheaded, dizziness, trouble sleeping, anxiety, libido problems. Like there's a ton of stuff. Digestive issues, that's a huge one. People get all kinds of symptoms from these complex chronic health conditions, but it's because they're so multi-systematic, right? You can have problems in all these different systems of the body. But what that does is that starts to create confusion for not only the patient, but also anybody they talk to about it, right? So if you have a loved one, friend, family member, coworker, whatever, and you're talking to them saying, I don't feel right, I don't feel good. Sometimes it's a big enough process just to get to the point where you can admit that, right? Where you actually know that what you're feeling isn't just old age. It's not just normal. There was one lady who went through the program very early on, and I was really astounded because she didn't even realize that she had fibromyalgia until she wound up talking to her sister, and they were both kind of, getting aging, right? And she said, oh, my sister doesn't have all this kind of chronic pain and all these wandering pains and trouble getting out of bed with stiffness and exhaustion. My sister seems to be healthy and fine. I'm having these, I thought it was just a function of getting older. Now I'm thinking that maybe there's something actually kind of off balance in my body, right? Maybe I have something I can get a diagnosis, maybe get help, right? That was for her. She had to realize that what she was feeling, all these pains and fatigue and all that, it's not just a function of getting older, right? Sometimes there's actually pathologies going on. And I would offer, while we're on this tangent, while we're on this subject, is that getting older doesn't have to mean getting sicker, right? The more pathologies we have, the older we feel. So if we want to start to reverse that, if we want to start to have vitality and longevity and live a long time with quality in our life, then we need to get ourselves healthier too. So you can kind of slow down aging in a sense if you can slow down the deterioration in the body, but that's not what this video is about. We're mainly focused on getting out of the pit, right, of complex chronic health conditions. But I found it quite interesting because it's not just black and white on a paper, right? The experience of a human going through this process needs to be respected. We need to understand that there's a lot going on in terms of the emotions and the spirit and the willpower of any human being going through this kind of process. And when you have confusion about if what you're feeling is real or not, if what you're feeling is actually clinically relevant or not, or if it's just aging, right? All that confusion is just muddies the waters and it blocks you from actually getting better. So one of these things in this phase is the it's all in your head phase, right? Where you think maybe this is all in my head, right? Maybe I'm making this up. And then we get some external validation like, hey, my sister, who's almost my same age, doesn't have these same problems. Or most people I know don't seem to have these same problems, right? Or other people do have them, they're not talking about them. And maybe you bring that up and you start to find out that maybe, some of your friends are having similar problems. But again, just because it's normal doesn't mean it's normal, right? Just because it's common doesn't mean it's healthy. So we get through that, and then you go, okay, I think I might have a problem. And now you're talking to friends and family members and doctors and saying, I feel exhausted. I feel like I can't focus. Like I walk in a room, I don't even know what I came in here for. I'm reading something and halfway down the page, I forgot what I read. Brain fog, right? This kind of thing. And if you go to the doctor, especially if they are doing the head scratch, right, because it starts to become a very complex symptom picture, right, then sometimes doctors, and I have friends that are doctors, I train doctors, right? They're lovely people, usually have very good hearts and very sharp minds. They are, however, typically stuck in a system that doesn't allow them to really excel at the types of complex chronic health conditions that we focus on here, right? But they can be stuck in a system, and also they can also have cognitive dissonance, which means in the doctor's mind, they're thinking, hey, I want to be a good doctor. I want to help people, right? At the same time, they're having to hold that, and they're also having to hold, I don't know what to do with you, right? So one of the ways that they do cognitive dissonance is, unfortunately, is very subconscious, and this can happen to any of us, right? It's not just doctors. But they'll say, okay, well, I'm just going to ignore that part, right? And I just want to go back to I'm a good doctor. So maybe it's all in your head. And that'll manifest with a comment that sounds helpful or like a compliment on the surface. Like, yeah, but you look so healthy. Yeah, but you look good. Oh, it's just aging, right? And they kind of brush off your complaints and your problems. That's not because they don't like you, don't care about you. It's often a function of cognitive dissonance where they're choosing the reality of, I'm a doctor, I know what I'm doing. Here's a case where I don't understand, so I'm just going to pretend that's not a case, right? So that's what happens there. But also friends and family members too. And it really stinks when people don't believe you that you're in pain, because part of it is saying, when I say pain, I mean any symptom that's at a high enough level that it's bothering you and it's basically ruining your life to some extent, right? So you don't feel like yourself anymore. And then you talk to people about it and they say, well, yeah, but you don't look sick. How many people I've met going through this process work so hard to not look sick, right? It's like, well, thank you. I did everything I could do to present a happy, healthy face to the world today because I don't want to be treated like a sick person. Most of the people I work with, they're tough. They're pushed through it kind of people, which, as a side note, sometimes that's what causes the illness in the first place, is because we keep pushing and we don't listen, right? So some of this is actually a path of learning a new way to be, which includes tuning into your own body and actually respecting what it says, that's a different level. That's what we do like within our group and within our programs is kind of walk you through that and start to regain the trust and the accuracy to your intuition and your animal instincts in terms of healing, so that you can get back to what your body actually needs to get better, right? That's a whole different topic, and I've done plenty of videos on that. So what gets really interesting though is where it becomes a compliment, right? But you look so good. Yeah, but I don't feel good, right? And the between the lines, kind of under the surface thing is, I don't believe you. And that's kind of what people are saying. I find it hard to believe that you look so nice and you're so sick, right? And that's just a function of how hard you work to present a healthy-ish kind of veneer to the rest of the world. So this is all, if you're feeling this, one of the reasons I made this video is because I think from my experience that a lot of folks that are going through this, and when they're in this stage of healing, they feel very alone. And if this is you, if you're feeling this right now, I'm bringing this up so you don't have to feel alone. I'm telling you, this is actually quite normal as part of the journey, right? The process is going through this little bit of a trial, right? It's a little bit of a difficult challenge where you're coming to terms with this reality, and some of the people around you are not making it easy for you to do that, right? Because they want to stay in the old reality where, well, there's nothing wrong with you, right? But deep down there is something going on. And the only way to get answers to that is to not avoid it and run from it or hide it or pretend it isn't there, but to actually dive in and confront it and face it and embrace that, right? Embrace the challenge. There's no easy way about this, right? The thing I can do that's helpful is to take some of the overwhelm out, right? That's part of my job, is to absorb that complexity, because when you do dive in and you go, okay, this is what's going on with me. I've got all these symptoms, these possible diagnoses, right? Here's what my labs look like. Here are the foods that set me off. Here's all the stuff I can't do anymore because I don't trust my body to maintain. So I'm not saying yes to social events. I'm not being there for my friends and family. I'm not taking care of people. I'm not traveling. I'm not dancing. I'm not having any fun, right? I'm not exercising anymore. All these things you give up. Right, you get that whole list and you take all this stuff and spread it out on the table, and then it gets overwhelming. What are all the things you can do to help? Here's 10,000 different supplements and advice from different people and a bunch of different professionals and practitioners and all this stuff. And you just got a pile, and you can get information paralysis, right? You can get overwhelmed. So part of my job, as I see it, is to absorb some of that complexity. And that's a lot of what we do in our group, is have these kinds of conversations so that we can get all your pile kind of organized so you at least know where to start. You're not getting overwhelmed. Because guess what? When we have too much information, we don't do anything. We just kind of sit there. We're paralyzed, right? It's just a function of our brains. We can only handle so much. So sometimes it's very helpful to have an experienced guide or a lot of people that are on the same path, right? Have camaraderie and people that understand so they can help each other. You know, it's very important. But this is one significant part of the journey. It's nowhere near the end, right? And if you're watching this, you're probably more towards the early stages of actually getting better. If you're getting stuck in this, like, but you don't look sick kind of thing. And you're going to break through that, because what you're going to learn, one of the lessons here to learn, is not to always believe other people and instead believe yourself, right? Because if you're having this feeling like, I don't think this isn't right, and everybody around you says, yeah, but you're fine, then you have a choice to make. You have a decision to make at that point. Do you trust yourself, or do you ignore your feelings and just go with what external people are saying? There's a big lesson there, very big lesson. The kind of people that can choose themselves, ultimately that's a trait that helps with the healing process. I've helped a lot of people through this journey, and there are common traits I've noticed. The people who do the best, right? Not everybody succeeds. I don't have 100% success rate, right, with the cases I take on. That's insane to think that there's always people that fall through the cracks, or there are cases that are just kind of off. And there's a lot of, and I examine those too, right? I study the people who do really well. I look for their commonalities, and then I always look for the people where they didn't get the results they should have, right, on paper. And then I start finding out some of the hidden aspects that were there, some of the little spokes that were getting jammed up in their wheels, right? What's that stick in the spokes of your bike? What's that thing jamming you up? And sometimes it's subconscious. Sometimes it's mindset. Sometimes it's the unwillingness to believe yourself over what everybody else is saying, right? Or the unwillingness when you go to a doctor or some kind of professional, and here they come with their authority and they say, there's nothing wrong with you, or your labs look good, or you don't look sick, right? That kind of thing. And you abdicate your own sovereignty, your own responsibility. You give that up and you say, well, you must be right. You're the authority, right? Good luck with medical independence over time. You know, so we have to develop a different kind of mindset, not that challenges authority, not that aggressive, but very creative and critical thinking, right? Being able to think outside the box of authority, and also to take whatever you hear and learn, including from me and my mouth, right? I'm not immune to this either. You should be listening to me with your mind open and receptive, but also filtering and paying attention, right? You want to take new information and you want to kind of pressure test it, right? So that what you do wind up learning, you can own that, and you can actually find some truth there. It's really quite interesting. All the subtle subconscious forces that are behind healing. It's really not as simple as, here, take this pill, right? If it were, I would just have a video about that pill, because I would want everybody to know. Right, that would just be the whole channel. Here's the pill, go get it, you know? But instead, we have these complex, multifaceted problems, and we have to learn to navigate that. And one of the things, not that it's all in your head by any stretch, right? But one of the things is to get your head right and start to know your priorities. Where's your self-care live, right? How much care can you take to yourself and to other people, and where's the balance there? How much give and take is there between what other people want from you and what you can do? How much of your reality do you allow other people to frame and determine? Right? Whether it's an authority figure with a white coat, or it's a loved one around you, or something like that. And we start to become more and more independent, right? It's a process. It's a learning process. But I found the people who do the best long-term, meaning they get their life back, they get their symptoms down, they outgrow their diagnosis, they outgrow their supplements, right? That's another thing. It's a really cool win when you no longer need the supplements you've been taking because your body's making that stuff on its own again. Fantastic, right? Those kinds of people tend to have an attitude where it's easier for them to own some of the responsibility of healing, and it's easier for them to question authority and start to learn to think for themselves, right? And part of my job is to offer different tools and different ways. And basically, I share a lot of the same problem solving that I use when I'm mentoring colleagues, when I teach other professionals and practitioners how to assess complex cases and how to do it in a way that makes sense and also feels intuitively right. I teach a lot of the same frameworks to the patients, right? Why not? You know, you're going to be with you all day long. You see a health professional once in a while, but all day, every day, you're there too. And the more you learn how to take care of yourself and filter the information you're getting, then the better you're going to do long term. So if you are struggling with a complex chronic health condition, even if you don't look sick, right, you might find that there's great company to be had in our Modern Vitality Solutions and Support group. It's a free group to join. I'm in there every single day. You can ask me anything you want, and I'll happily give you my perspective. We've got lovely people from around the world. Everybody's going through their process. Stage 1 is immune system. Stage 2 is digestive. Stage 3 is neuroadrenal. Stage 4 is blood circulation. There's kind of a bonus secret stage 5, which I'll talk about that in another video. But everybody's moving through the process. And what you get to see there is really interesting because I do have programs, right? It's not cheap to work with me. I value my time. I know what I'm doing. But even if you aren't in that position, you just want to come in and learn, right? Or if you are thinking of working with me, come in and check out the environment. It's free to join. You can be there as a guest. You can ask me anything, and you get to see our culture, and you get to see what happens to people who are working through the stages and when they don't have a good day, right? When they backslide, when they get triggered, when they move some furniture and there's a bunch of mold under there and they inhale all that and then they're just messed up from that, right? And how do we navigate out of those hard days? How do we troubleshoot that? How do we work this system to get you back on track so that no matter what happens, you always know what to do, right? How do we do that? You can come watch, you can come observe, you can be over my shoulder, kind of a fly on the wall, or you can be in there asking all kinds of questions, right? We welcome all kinds of folks. Most of them are kind of introverted, but we do have some really outgoing folks in there too. It's a nice dynamic environment, very positive. So the application's in the description where you would expect to find a link. And if I see your application and it looks fantastic, I will welcome you into the group as soon as I can. Might be a couple weeks, might be a couple months. I keep it small so we do fill up. But there, if there's a wait, there's a wait. In the meantime, subscribe to the channel, like the video, right? That's how you tell the algorithm that this kind of stuff matters to you. And if you're trying to heal, you're trying to get your life back from a complex chronic inflammatory condition, that's probably the biggest thing on your plate right now. And that's where I would offer, you may want to spend most of your focus, right? So yes, cat videos are fun and kind of mindlessly scrolling the feed is fun, but at the same time, train that algorithm to show you stuff that's actually going to help you heal. It's very important. You're worth it. I hope this video helps you. Let's get you feeling better. Cheers.